Hey, it's Alondra La OT, and today I am with my very special guest, Dr. Elizabeth Ching, and we are going to talk about OT in academia and some of her passions. So stay tuned. So before we start, you know what time it is. 3 in 30. So 3 questions, 30 seconds. Are you ready?
Yes.
Okay. First question. Name one thing related to OT that starts with the letter H. Go.
Oh my goodness. Happiness?
Okay, happiness. All right. Current OT setting, practice that you're in.
Academic.
Okay. And top 3 leisure activities.
Ooh, watching NBA basketball games with my family.
That's a long one.
Knitting.
Okay.
And taking long walks and hikes.
Yeah! 25 seconds! All right, we did it, guys. Okay, so what is your ethnic background and what are some of the OT settings that you practiced in?
Okay, I am a 3rd generation Korean Chinese American.
Mm-hmm.
I'm from Vallejo, V-Town here in California. Mm-hmm. I've mainly worked in mental health, mm-hmm. and I've also worked more recently with folks with brain injury.
Okay.
And so that's been my general practice settings. I've been in OT since 1985, so you all do the math.
You have experience here. Give me your knowledge. All right, so you currently practice in an academic setting and practicing as an OT here at Samuel Merritt University. Shout out.
Yes.
What interested you or sparked your interest into teaching in academia?
Well, originally I was in a mental health setting, and I facilitated a lot of groups. Mm-hmm. And actually, my one of my older brothers is a high school teacher. Okay. And I told him how much I enjoyed facilitating groups. Mm. And he said, "Why don't you just become a teacher?"
It's in the blood.
And I said, "Oh my goodness, I never thought of that." And so it was a great way to combine my passions of OT, right, and also being a teacher. Okay. And so I've taught at an occupational therapy assistant school, and now I'm here at Samuel Merritt.
Okay. And what made you start at that point?
Well, actually, since I've been in OT since 1985. I have a baccalaureate, so a bachelor's degree in OT. Mm-hmm. The first time I went to OT school, and actually, I was teaching at what was called a clubhouse model in a community-based psychiatric facility.
Ginny Stoffel.
Exactly. Yes. Our former AOTA president. That's correct. Actually, I was there as an occupational therapist, but again, it was a non-traditional setting, so translation, the pay was pretty low, and so they employed me later as an adult education teacher. So I had to get an adult education credential, and that was kind of how my eyes opened up around becoming an educator. So then I further needed to go back and get my master's, and so I have my master's in education, and I also have a concentration in multicultural education. So that was kind of where I was at with that, because I needed to have a master's in order to teach. And
right. And then recently, now you received your doctorate in occupational therapy.
Exactly.
And that's to be able to teach at a doctorate level, or?
That's exactly right. Okay. We've had since 1994, we've had a Master's of Occupational Therapy program, and we just transitioned last year, 2017, to an entry-level doctoral program. Right. And so I needed to have at least the same degree as the students that were planning to graduate.
Right. What makes you passionate about advocating for representation of people of color within the profession?
That's an excellent question. I guess, going back to my the way back, as I mentioned to you in Vallejo, my family we were the only ones. I come from a pretty working class background, and we were the only ones of our racial group where we were living at the time. So I can't think of a time, honestly, where I haven't been thinking about these things, because I've always been, and like many of us, I've always felt kind of on the outside looking in. And so when I got into this wonderful profession, long story short, as of 2015, the workforce study that was given to occupational therapy practitioners in the U.S. Showed that about 14% of the OT practitioners identified as people of color. And I make a conscious effort to say people of color because that's the more common term used these days. And if you look at the literature, rather than minorities, because as we all know, in the very near future, quote unquote minorities will be the majority of the U.S. in
Right.
terms of if you look at all the different demographic groups of ethnic and racial groups put
Right.
together, we will outnumber in the near future Caucasians or the white population.
Right. I need to stop saying minority. It's a habit, though.
Sure,
you
yeah.
know,
We all get
and
caught
some
up
people
with it.
prefer minority over, but I think it does stand true to work in our benefit. I think to say people of color, because a minority already kind of drops us down to a different, level, and just saying minority. So
Exactly. I believe also we talk about in occupational therapy so much is around people first language.
right,
And so much of the literature in the past used to say non-white. And so if you think about that, that's not people first language. You don't name people by what they are not.
right.
So yes, we have to sort of train ourselves.
Yeah.
I often
Train my
educate
brain.
ourselves. Yes.
But that's the great thing about being an educator. You get to educate us on proper terminology and language, but also just impart so much knowledge and wisdom around cultural awareness. And I think that's much needed in our profession. And I think it just helps to better serve our clients and the patients that we're going to encounter. So, and I know another thing that you love to talk about are the health disparities. That people of color may experience, the quality of care that one may receive because they are a person of color. So really eye-opening to see and learn about the statistics, and so I really appreciated that course. I'm like, I wish you could give the course now. Educate yourself.
Well, I feel like it's a two-way process. Alondra, you've been a wonderful former student now. So you're a graduate, yay!
you.
Passed your boards, yay! That's what makes me so excited about being in an academic setting, because I feel like, I know it's so cliche, but I really
Right.
feel like I learned so much from students. So I think it's a two-way process, and I also feel like around the health disparities, like you mentioned, I guess that's when you control for income, even now in 2018, if you look at African American women, their infant mortality rates are so much higher than white women. And if you control for income, more affluent African American women
Right.
still have a poor outcomes in terms of infant mortality rate. So what's that about, right?
Yeah.
So we talk about our goal is health equity, right? So we want to keep it on a positive note. We want to look at all these disparities and then work towards health equity.
Right.
So that's part of our process. And in our accreditation standards, we still use the term cultural competence, and I understand that, and that's across the board for many health science professions. But I think a term that I really like to use, and it's been in the literature a lot, it actually comes from education. And since I have a master's in education and I have the doctorate in occupational therapy and health sciences, I like to use things that often come from education, and they're sort of trendsetters, but
Right.
now we use that in health. So I like to use the term cultural responsiveness, because that's a term that I believe is very easy to understand, and
Right.
it sounds more action-oriented, less passive.
Right.
And it doesn't sound like there's an endpoint like with competency.
Right.
Another wonderful term is cultural humility, which came earlier. But again, I think when you use cultural responsiveness,
Right.
it sounds more like a two-way process.
Right. And I think it's hard for anyone to be culturally competent. How do
Exactly.
you become culturally competent? I've never heard of the term cultural responsiveness, so that's a new one for me. Look at you. She's still educating me, and I'm not even a student. Before I let you go, any final advice for OTs considering a career in academia?
Ooh, that's. I would say yes. It's a wonderful career. We often would say to students, become a practitioner for about 5 years, and then you have some really wonderful stories to share with your students. Sometimes people might think about it even before then, but definitely after 5 years, think about it, because you contribute so much more to our profession.
Right.
Because we need a diversity of viewpoints. We need a diversity of not only folks of particular racial, ethnic backgrounds, but we need men in our profession.
Yes.
We need to have role models for our students. So you can teach at an occupational therapy assistant school. Most times, if you have a master's, and even bachelor's, depending. And also if you're an adjunct or a clinical instructor, sometimes the degree requirements are not as intensive.
Right.
And that's a nice way to get your feet wet, to see if that's really the career for you.
Right. See?
So
if you're interested, find ways to kind of just start out, and get your feet wet and see if this is something that you want to do. All right, so we're coming to an end, but before we let you go, it's time for the palabra del día. So the word for today is family. In Spanish, it's familia. You want to try it?
Familia.
Familia. It's an easy one, right? It's not too very similar. So familia. So if you want to know if the patient has caregivers or is being discharged and they will have someone to take care of them, you can ask them, familia, do you have familia? So yes, familia. Alrighty guys, till next time, don't forget to hit this like button down there. That concludes this interview. Thank you so much for being my guest.
Of course.
Thank you so much.
Thank you.
You will see me around, maybe in academia. I'm all like 5, 10. Testing 1, 2, 3.